This is Speak to the Gynecologist page. You may have watched the introductory video where I stated that the objective of this page is to empower women and men with evidence-based knowledge on reproductive health. The topic of today's video, which is the first video, is menstruation. I'm starting with menstruation because menstruation is the beginning of a woman's reproductive life. You may ask, what is menstruation and why do women menstruate? To understand that, I need to take you to this diagram of a woman's reproductive system. These are the organs of the reproductive system. This is the vagina. That is the uterus or the womb. The uterus has two fallopian tubes. This is one tube. This is the other tube. A woman has two ovaries. The ovaries contain eggs. When a female child is born, she is born with a fixed number of eggs in each ovary. She does not need the eggs until puberty when she starts menstruating. What happens is the eggs in the ovary are not mature. At the beginning of the first day of menses, a few hundred eggs begin to grow, trying to attain maturity. After about 10 to 16 days, depending on the cycle, one egg will mature, occasionally two. The ovary now ruptures to release the mature egg, and that mature egg goes into the tube. The release of the mature egg and its entry into the tube is what we know as ovulation. That egg survives in the tube for only 2 days. Meantime, if the woman has sexual contact, the sperm is released in the vagina, it travels upwards into the womb, from the womb into the tube. If one sperm is able to join with the egg in the tube, that's the beginning of pregnancy, and that's what we call fertilization. Meantime, while all this is going on, the inner lining of the womb, this inner one, is called the endometrium, begins to develop because that is where the pregnancy is going to implant. After 72 hours, the pregnancy now moves into the womb and implants on the lining and derives its blood supply from there. But if the woman does not get pregnant, after 48 hours, the egg will die and is flushed out. Since there is no egg, it means there will be no pregnancy. The lining is duly informed there will be no pregnancy, which means there is no job for this lining which had grown expecting a pregnancy. The lining dies and sheds. That is menstruation. Menstruation is the shedding of the lining of the womb which had grown anticipating a pregnancy, but the pregnancy failed to come. In essence, the woman's body is designed to get ready for pregnancy every month. This goes on until when the eggs finish from the ovaries, there will be no more ovulation, no more lining growth, no more shedding of lining, and that's menopause. The period between which a woman is ovulating and menstruating is what we call the reproductive phase. A woman has 3 phases in her life: the prepubertal phase, then the puberty when she starts menstruating, and the menopause. So the pubertal phase, which we call the reproductive phase, starts as soon as the woman starts ovulating. The usual age of onset of menstruation is around the age of 12. The onset of menses, we call it menarche. Menarche starts between 12 to 15, but in recent years, because people's standard of living has increased, girls develop a lot faster, and the age has gone down to about 9. It can even be much earlier. And when it occurs very early, we call it precocious development. When you see a girl of 5 or 6 developing breasts, secondary sexual characteristics, and she starts menstruating. One thing to know is that once a girl starts menstruating, it means she's ovulating, and it means she can get pregnant no matter how young she is. It might interest you to know that the youngest mother on record is a Peruvian girl called Lina, who was delivered of a baby boy at the age of 5 years, 7 months, and 20 days. The baby survived, and he was raised as her brother. So which means she got pregnant before she was 5. So this is a warning to parents. When you see your young girl developing so fast, try and see a pediatric gynecologist or an endocrinologist who will discuss with you the options. Sometimes they're able to give you medications that will slow down development. But don't ignore it because the girl is naive, not well informed, and can easily be exploited in school by other girls. Because once a girl starts menstruating, you just remember that it means she can get pregnant, whether she's 4 or 5 or 6. That's what. The issue you now ask, How long does menses last? The average menses should last between 2 to 5 days, but there is no virtue in heavy bleeding because the blood you are losing during menses is not different from the blood you lose when you break your head, cut your hand, or break your leg. But somehow, when we're bleeding from an injury, broken head, broken hand, we rush to the doctor. When it's menses and it's rushing, in this part of the world, the women are very happy. They look at it, they're very happy. Ah, it's red, it's rushing. You're losing blood. You're losing something. So anything that makes you bleed too much depletes the amount of blood you have in your body. Let me, as an analogy, the blood supply to the body is like a tank of water on the roof of this house, supplying the whole house. So whether you open a tap in the kitchen, in the bathroom, in the garden, it's the same water you're using. If you leave any tap open, it can run the tank dry. The same thing with the human body. You can bleed to death from a broken head, a broken leg, and from the womb. After all, women bleed to death after having a baby. Where is it coming from? It's from the womb. So anything that makes you bleed too much is not good. If you bleed too much, whether it's from your leg or from your head or from your menses, go and see a doctor and complain. In essence, it might be shocking to our women here that a woman who bleeds for 2 days is actually healthier than a woman who bleeds for 7 days because she's losing less blood, has more blood in her body. When patients complain to me, doctor, my menses is not very heavy, I usually tease them. I say, look, madam, you're saving money on pads and saving your blood, which is very true. Men have more blood than women because we don't menstruate. So you have no virtue. You gain nothing by bleeding too much. The gynecologist always asks you, when did you start menstruating? We don't ask you when did you stop, because that is the day, we call it the first day of the cycle. That's the day your eggs start developing. With that date, we're able to predict when your ovulation is going to be based on your cycle. The other thing people ask is, what color should it be? I always have patients saying it must be red. It rushes for 5 days. I said, I have not seen it written in any holy book that it must be red and rushing for 5 days. No, it doesn't have to be red. Yes, it could be red. But blood, when it comes out fresh, is red. But after some time, if it stagnates in the vagina, it can change color to black. There's nothing wrong with that. Blood that is black must have been red a few hours earlier. Once it goes into the vagina, if it's not very heavy, it's broken down by the acidic contents of the vagina and the color changes. Sometimes it acquires a smell. It's not an infection. We just call it old blood. So please don't take antibiotics because your blood is dark and you're seeing, and it's taking time to come out and it's smelly. It's not spiritual attack. It's not an enemy dealing with you. Nature, that's the way nature is. The amount of blood you lose depends on the size of the womb, the thickness of the lining. So some months when the lining is thick, you bleed more. When the lining is thin, you bleed less, but it doesn't really matter. And like I said earlier, the less you bleed, the healthier for you and the better for you. Others will ask, how long does a woman menstruate in a lifetime? A woman ovulates between 400 and 450 times in a lifetime. So you ovulate about the same number of times, between 400 and 450. In essence, a woman spends 37 to 39 years of her life menstruating. Those who menstruate all the time, normally the average woman has a biological break. By that I mean pregnancy. When you're pregnant for those 9 months or so, you don't ovulate, you don't menstruate. That's a biological break. The months when you're breastfeeding and you're not menstruating, equally having a biological break, you're not ovulating. So you have more eggs. So women who have biological breaks tend to menstruate much longer, and their menopause occurs much later. But a spinster or like a nun who has no biological break will attain that 400 and 450 or 450 menstruations within a shorter time. And most of them, the eggs will finish around the age of early 40s and they become menopausal. There's nothing you can do about that. But the menses ends between 48 and 52 in most women. That's what they call menopause. Once the eggs finish in the ovary, there'll be no more ovulation. The lining will stop growing and there'll be no more shedding. That is the final natural stoppage of the menses. And that is the end of the reproductive life. And then menopause starts. There's nothing wrong with this. It doesn't require any treatment. The age is not permanent in everybody. Your sister's menopausal age might be different from yours because you were born with two different numbers of eggs. You had more biological breaks than she did. So don't compare yourself to anybody else. That's just the way it is. Is it important to your health to menstruate? Not really. Can you suppress your menses or delay it? Yes. In this part of the world, women who go to Mecca for the pilgrimage do not want to menstruate while they are there. We give them some progesterone tablets, which will start before ovulation, and she just takes them regularly twice a day until she's done with whatever she's trying to do. When you stop taking the medications, within 2 or 3 days, you will bleed. Furthermore, there are professionals in the Western world who don't want to have children and who menses might be a nuisance for them, like astronauts who spend months in space, pilots, high-flying financial officers. They might request that menses be delayed, and we can do that in 2 ways. You see, if you take the contraceptive pill, it blocks the ovary, so there'll be no ovulation. When there's no ovulation, there's no growth of the lining, and it will not shed. So that's one way of stopping it. If you take contraceptive pill non-stop for as many months as you want, don't have a break, there'll be no ovulation, there'll be no endometrial growth, and there'll be no shedding, so there'll be no menses. You can take it for as long as you want, 3 months, 6 months, 9 months, as long as you don't have a break, there'll be no menses. There's nothing wrong with that. It's not injurious to your health. It's not bad blood hiding somewhere, just a natural process. There are some, so the essence of menses is, one, regular menses implies regular ovulation. So a woman knows that I'm ovulating regularly. So when I want to get pregnant, that's one component of the things you need for pregnancy, that you are ovulating. And if all the other things are right, you should be able to get pregnant. And that sense of well-being and psychological satisfaction, yes, I'm menstruating regularly and I know I'm fine. So in essence, to recap, menses is a natural process. It's not the cleansing of your body from old blood. No. When you don't menstruate, it doesn't mean that enemies are sucking your blood or your mate in the house is dealing with you. It's not true. You don't menstruate because you don't ovulate. Sometimes extremes of emotion, too much happiness, too much sadness can affect your ovulation. And when that happens, you won't ovulate, you won't menstruate. Young girls getting married and moving to a new house, the social upheaval, a young girl who was on her own, fancy free, now becomes manager of her home. It affects her psychologically. So most of them, for the first 3 months, may not menstruate. And people think they are pregnant. They are not pregnant. I mean, they haven't been able to ovulate. Once they adjust to the environment and their new designation, new responsibilities, they begin to ovulate. So when a girl comes in and doesn't menstruate, don't assume she's pregnant. She may not be. Do a pregnancy test. That happens. The other point to make is that when a girl starts menstruating for the first time, it may not be regular. Most of them may not get regular till about the age of 18 to 20. That will be no problem if the girl is not sexually active. Then parents don't have to worry. But if you're not sure she's sexually active, or she might be, then you have to test her urine each month she misses her menses, and then she should be advised about contraception. That's why mothers should be friends with their daughters. Don't bully them. Be close to them so they can talk to you and let you know what their problems are. So you'll be able to know when things happen to them. So that these are the issues about menstruation, and I hope you've gained something from this. By the way, you make your comments after every video. I'll try and read those comments and I'll respond to them before the beginning of the next video. Thank you.